Hi, and welcome to After the Anchor podcast. I am Leslie Wise, and I have a very special guest with me today. She is my neighbor and a very close friend of mine, and her name is Laurie Model. She is a medical professional, and in my life today, I can't imagine a better guest to have on this podcast because she's here to answer lots of medical questions that women are confused about. They don't even know that they're having a medical problem. They think that it is all their fault because we put a lot of pressure on ourselves. So we just think that this is just the way we're supposed to feel at 40, after life has given you everything that it's already thrown at you. You're like, well, this is just the way that it goes. And we have Laurie here today, and she's going to tell us about how this is not normal. Laurie, tell us a little bit about yourself, and then we'll get into the podcast.
Okay. So, like she said, my name is Laurie Model. I'm a physician assistant, and I've been a PA for over 20 years, which makes me super old, but also super knowledgeable, right?
Very knowledgeable.
Yes, with age comes wisdom. So I've been in primary care actually mostly with HIV positive patients and hepatitis C positive patients for my entire career. That's been my passion for my entire life. I actually knew in middle school that I wanted to do something with HIV. So I am one of the lucky ones that has been able to follow that dream ever since I was little. So that's pretty cool. But around the time that I turned 38, 39, 40, when things started shifting in my own body, in my own life, and I really, even as a medical provider, didn't know what was going on with myself, I knew that I needed to step out of that, the box that I had created for myself for so long of but being an HIV provider, being an infectious disease provider, and learning more so that not only I could figure it out for myself first, but start to treat my own patients and help my friends and my followers and everybody else kind of figure out what's going on. Why do I feel so different? And is this normal?
Yeah, I feel like I'm saying this more so in the last week than ever, but Curtis said to me a couple weeks ago, you're never going to know where your business, where your ideas, where your life, so you have this, and you're not deterred, you're not going away from your calling. You found that you also have value and in this other calling as well, and it helps the people that are really close to you, not just patients that are strangers that come into looking for help. These are like people that you care you care for your patients.
Right.
You know what I mean? Let's not turn that into anything. Okay, so I always like to talk about the things I talk about with Curtis. So, my brain's a little scrambled, and it makes me think in my mental health journey, I have self-diagnosed myself with everything from narcissistic personality disorder to bipolar to I think I might be schizophrenic. And I've been able to really abolish a lot of those beliefs or those diagnoses. Not that there's anything wrong with any of them. They're very serious, and I have felt very seriously ill. I've not looked at this willy-nilly. And it really kind of made me sad about a month ago, I was telling Curtis, I was like, if I had been born in the 20s or 1910 or the late 1800s, whatever, whenever this man, Dr. Freeman, I was telling you, Laurie, earlier, I wasn't even going to give him, learn his name. That's how uninterested I am in this buffoon. But Walter Freeman used to perform lobotomies. So back to what I was jumped around. I told Curtis that I would be institutionalized. We would have gone to a doctor to seek care, not because he wanted to put me in a home or anywhere. We would have gone to seek care, and we would have found somebody who would have been like, yeah, she's got mania, she's hysterical, she's this and that, and we'll fix her with drugs, whatever the drugs were, cocaine and all that stuff that, so now we're addicted and we've got mental health disorders that everybody's just saying something's wrong with you.
So do you know why they used the word hysteria back then?
Tell me.
So this is super interesting, and I learned this not that long ago. So the Latin, I think Latin, maybe Greek, but I think Latin derivative, hyster, is for the uterus. So we use the word hyster, like hysterectomy. We take out the uterus. They thought women who have uteruses were hysterical, like crazy. They thought we were crazy. Our uteruses made us crazy.
Because of our cycles. So they just said, oh, well, she's about to be, they were able to time this. Okay, she was in the doctor's office a month ago at this time, and when do you, of course they were looking at all of that. So yeah, we were labeled imbeciles, hysterical, defiant for sure. I could see that I would be, I'm all of those. I'm neurotic.
We're all of the things.
They were not insults. They were literal diagnoses. And they stripped, can you imagine? You're a professional. Well, no, you wouldn't have been a professional back then.
No, I wouldn't have been a professional.
Nobody would have been a professional. Yeah. So that's da-da-da. Anyway, he wasn't even a surgeon. He was pretty much, he just wanted to be like his father and his grandfather. And he could never amount to what they were. They were all neuroscientists and neurosurgeons. So actually, Rosemary Kennedy, part of the Kennedy family, at 23, her father authorized a lobotomy because she was described as moody and difficult.
Oh,
afterward, she could barely speak or walk. She spent her life hidden away in an institution. Because, they're not going to fix it with a lobotomy.
And I think that was super common, which is nuts.
Unfortunately, it was not just two women. Also, there was a young boy, Howard Dooley. He was 12 years old. His stepmom called him defiant. So Freeman lobotomized him. He lost decades of his life in foster homes, institution, and he just was not able to progress. So by 1950. My mom was born in 1943, so this makes me
more mad.
That's crazy. It's so close.
Crazy. Yeah.
60% of lobotomy patients in the U.S. were women. In Canada, it was closer to 75. Well, no wonder seasonal depression. It's even colder.
Gosh, right.
What the heck?
Wow.
They were their conditions: not violent psychosis, depression, anxiety, postpartum mood swings, and even being too opinionated.
I had no idea they were doing this in the 50s.
So luckily there was, that's pretty crazy.
That's crazy.
It's pretty crazy.
Our parents were around.
But we weren't even allowed to vote against this.
Right.
Anyway, I could segue into something completely. I saw some evangelist man. It's like he wants to do household voting. The head of the house votes.
Oh.
He discusses it with his family, and then he votes.
And then
Okay. Yeah, right. Freeman. Anyway, so there is a shift. Thank goodness. It didn't come from Freeman dying, but Dr. Karen Horney stood up to Freud, declaring women didn't suffer from penis envy. They suffered under patriarchy. Dr. Mary Putman discovered the myth that menstruation made women unfit to work or study. Dr. Elizabeth Kubler-Ross, I remember her, gave us the 5 stages of grief, validating emotional suffering. Dr. Marcia Linehan, if I pronounce any of these, developed DBT for people with borderline personality disorder, providing compassion-based therapy. Dr. John Bowlby proved trauma and attachment shaped mental health. There were a lot of people. So this is not like a physician bashing or medical bashing. It's just, there's a lot of unknowns that get stereotyped in medicine. And that's where we have come so far, but we still have so far to go.
Well,
because I have been misdiagnosed for very many years, and I love my physician. If he was still, he just retired.
Oh, I didn't
so
know
now
that.
I have to find a new one.
And I know how much you love your physician, but I
Yeah.
also know how much guidance you require, from
As a woman with mental health, and I don't want to, I'm not interested in psychiatric care at this point because I've come so far in my recovery. But if I'd had a little bit more knowledge on hormones and not just the basic blood work, like okay, yeah, your blood cells are great, your red cell counts are this and that. So this is we put out a question, and we put out a questionnaire asking some of your followers and our friends, and we want to get some of these asked. So now that we are not worrying about lobotomies and we can talk about openly, we hope that we can talk about these things that are really, I mean, it is a lonely place. It's a lonely place. And you've been through it. And I'm like I'm towards the end of the perimenopause, but I still have a lot of stuff to go.
Yeah. Yeah. So, interestingly, and I feel like everything happens for a reason, but out of like my friend group, like my high school and my college and my, like all these different friend groups that I've made along the way that are about the same age as me, I'm the very first person to have gone all the way through menopause to become postmenopausal. And I'm not even that old
You're the
yet.
first?
I'm the first. I'm the first.
That's so
But
cool.
I feel like it's for a reason because, I have the means and the degree and the resources
And the
to be able to, okay, let me learn about this and let me help, the people that I love in my life. But something you said like really struck a chord with me. And it was interesting that we had come all this way from lobotomies and, all these things, but we actually came a long way until around 2001, 2002. We were treating women with hormones for their menopause, and our grandmothers and maybe even our great grandmothers were getting menopausal therapy. And then there was a study published, and I think it was 2002. It was by the Women's Health Initiative, the biggest study ever published in the United States. I can't remember how many women were in it, but it was a lot. It was a strongly powered study, and unfortunately, the media got a hold of the results before it was really analyzed correctly, and they ran away with data that wasn't even correct. So all of a sudden, we had made all this progress for all of these years in the name of women's healthcare, and especially midlife women's healthcare, and then all over the headlines was like, hormone replacement therapy causes breast cancer. Hormone replacement therapy causes strokes. Like all of these bad, bad things. We went from, don't quote me on the percentages, but we went from like 40% of postmenopausal and postmenopausal women being on hormone therapy to like a couple percent overnight.
Yeah, I quit taking birth control because of that.
And that was in the early 2000s.
I was 20.
Already.
Yeah, I was 20, and I was like, that's when
we
I
were
was
in our
starting to
20s.
think. Everybody was like, quit taking this stuff. It's going to give you, cancer. Yeah, breast cancer.
Yeah.
That was terrifying. My niece had breast cancer, and she actually passed away
And
of breast
birth
cancer.
control pills are a much higher dose of hormones than,
Where do you think the misinformation, I know where the misinformation comes. Do you think it's because we are so desperate for information that we literally are constantly seeking new information, and it's like if it feels good for you, then you want to run with it? And do you think that the media really like pulls on people's like fear? Well,
yes. Yeah. I mean, to answer that question, yes. And to take a completely different medical topic, COVID. I'm an infectious disease provider first by trade. And so seeing some of the things that they were saying about COVID in the media where I knew firsthand were completely false, I was like, what? And that was the first time actually in my whole life that I was like, wow, the media is really
and you saw it.
scaremongering. And I saw it because I knew that the things that they were saying were incorrect. But to your first point, I actually think that, and I tell people this all the time, most of the medical providers right now, and most of the time, are in their 30s, 40s, or 50s, right? Like the bulk of the workforce is in their 30s, 40s, or 50s, maybe 60s. But for those of us that are that age, most of us were educated. Our medical education was in a time where we didn't prescribe hormones because we thought they were unsafe. So the average medical provider, be it MD, DO, PA, NP, even pharmacists, I don't know about pharmacists, but we had like 1 hour of menopause training period in our entire medical education. OBGYNs, which people think of is like, oh, they must be my hormone doctor because they delivered my baby and they do my pap smears and, they took out my uterus when I had
I don't even know if I want to hear how much.
6 hours max. And most of that wasn't even pharmacology. Pharmacology means like we're learning about what medications to prescribe. There was zero in my education. And I'm pretty sure because I went to school with my husband, who's a physician, I think there was zero pharmacology in his as well.
Yeah, so it's about,
that makes it hard.
I mean, you're glad that you know how to be, like how to have your baby delivered and how to be kept alive during delivery and and prenatal care. But that's all women's health. That's when I go, that's actually like where I went.
Right.
When I it was postpartum. That was the first one. And that was not where I should have even gone to begin with. It was like no panels were run because of my age. I was 33. It was just like you've got postpartum. She didn't have the knowledge.
No, and it's not to say that is of all providers, but we know because I just completed a certification to become a hormone health prescriber, so that I know that I'm providing the best quality care to my patients. And because I've been in this community with some of the top menopause doctors in the country, and I've heard them speak now for, over and over and over again. I know it's only like maybe 5% of all medical providers that have taken the time and resources and usually their own money to become knowledgeable in this subject area. Yeah. So it's not to say that your OBGYN doesn't know, because maybe they did spend.
No, because then there would have been discussion about it.
Yeah, so yours sounds like not.
I don't see any of that stuff. I'm trying to think, like, even going now, and I'm like, I wanted to be, I was like, I wish she'd be my friend, but I think that like trauma bonded me. But no, I'm looking around the room in my mind and I'm thinking, I did not see anything about hormone replacements. And so I only use an OBGYN for pap smears and to deliver a baby.
Yeah.
And that's all, so I mean, there's not a one-stop shop for women. And then we're going to have to find a new doctor.
Or they
in
are
geriatric.
a one-stop shop, they don't.
But they don't.
Most of them don't deal
I was
with
already
hormones.
thinking, so I'm 43, and I was thinking the next physician, because now I'm looking, I might as well find a physician that will go into senior care, like someone who already is knowledgeable, because I was with mine for 15 years. Okay, so you tell me, here's my question. That was my next one. I was like, I need to find a geriatric physician.
You don't need to find a geriatric physician. But I will say that as we get older and we have more complicated medical histories, which actually we're trying to prevent, right? Like, this conversation is so preventative. But if we start having complicated medical care, like we've got hypertension and we have high cholesterol, we have diabetes, and maybe we have like a neurodegenerative disease, that's internal medicine. So you just move from having, your family practice provider and your OBGYN, and you make sure that you have a good, knowledgeable internal medicine clinician. But with that being said, they may not do hormones. So it's still this thing where the most common question I get asked nearly almost every single day by somebody that I know, I'm really lucky to have a really big, a wide net of people that I'm connected with, is I went to my primary care provider and they don't do hormones. And I went to my OBGYN and they told me I can't be in perimenopause because I'm too young and I don't know what to do now. Where do I go? And that's a big problem.
Yeah, I've figured out your next venture. There's a company called Women's House, and it's all women's health. All women's health. You can have your hormones checked there. You can have your general practitioner, whatever. All of your physician, everybody, women's health is all in this. It's like a spa, but no spa.
Did you ever watch that show, Private Practice?
I did. There was, yes, they were always doing dirty stuff.
They were always doing dirty stuff, but two things. So I don't remember what her name is in real life. Kate Walsh.
Kate Walsh, yeah.
is the main character. Dr. Addison Shepherd Montgomery. I absolutely adored her. So that show was on when I was still kind of a baby clinician. And it was way before COVID, so I would dress up for work every day because now I just wear scrubs.
Yeah.
And I would think to myself, would Dr. Addison Shepherd Montgomery wear this? And if the answer was yes, then I would wear it. Oh my God, she was like my clinician fashion icon. But my point was that like this multidisciplinary approach to medicine, like, so maybe they were doing it, but she was delivering babies.
No, that is actually yes, and it was all like in
that,
one.
That would be,
and then
dreamy.
They worked together,
yes, to
for their patient. It's kind of like the place that I found in Coppell. I don't know the name of the place, but I'll link it. Your physician was not accepting new patients. Didn't know when
because she
they
left
were.
me. Okay, can we talk about that?
Yeah.
So I can prescribe medication, sure. And I can prescribe most hormones to myself, which is great if I had to. But I really want somebody to, look at my labs and like make, have a shared decision-making conversation with. And if I want to be on testosterone, which I do, totally different conversation, but I can't prescribe it because it's controlled. I've been through 4 clinicians in 2 years in one practice. I don't know what keeps happening to them, but they keep leaving. And even as a clinician myself, I can't find one.
Well, the place in Coppell has been there for a hot minute, and I really enjoyed it. I'll let you know about it. They had the nutrition in-house, and it would be like, oh, what if you just had like a physician also in-house? And that is the most genius thing.
Yes. Like actually putting, what all of these places are missing is there are these places that are popping up everywhere that are doing hormone health. And I mean, we could get into it could be an entire episode, unfortunately, on like all of the things that these pop-up clinics are doing. But if they put like an actual internal medicine physician like working in the clinic as opposed to just like owning the clinic and like they pop in once a month to sign off on charts, I think it would be incredible because you could have someone actually manage your chronic health conditions. You could have somebody else that's managing your hormones. You could have a nutritionist. You could have a psychiatrist.
Well, and that's why your operating officer would be like a retired physician who has no interest in practicing medicine, but he can do all the business and everything. So he keeps all the little ducklings in a row, but he doesn't actually have to practice any medicine.
Yeah.
I found you and your husband a new career. Let's do it. Let's do it.
Yes,
okay.
We'll see. I don't know if we could ever work together. We might kill each other, but we'll see. TBD.
Yeah, I think you could do it.
We'll see.
Yeah, he just has to
not ranch so much.
Yeah, he just has to be on the paperwork. Actually, just have you in charge.
Okay.
Yeah, just have you in charge. HB.
And I already know that my case management staff will come with me. They're just like, when you start, they're always joking. They're like, when you start your own practice and we join you.
We're manifesting that. Okay. What's your mood ring telling you right now?
I don't know.
How do you find, it's out there?
It's on my phone out there.
Curious
oh my God.
what it is. Could you imagine what your Oura ring would be? I don't have one. I don't know. So, okay, tell me what the Oura ring is.
Oh my gosh.
What do you do with it?
I'm obsessed with the Oura ring. Okay, so I'm actually obsessed with just data in general and tracking. So anybody that knows me will know that I've had about every smartwatch on the planet. I've had the Apple Watch. I've had the Garmin. I've had the 3 iterations of the Fitbit. And like I always am looking for the best data. And I wear an Apple Watch and I wear an Oura Ring because I do think that the Apple Watch gives me really good data, like when I'm working out and my exercise stuff.
So that's an Apple.
This is an Apple Watch.
Okay, and it works with your Oura Ring.
No, they're
Oh,
separate.
okay.
The Aura Ring is an app on my phone,
Okay.
so I have to log into the app to see what my
Okay.
stress score is right now. But what I love the Aura Ring for is it actually gives me feedback based on several things. Like it gives me feedback based on my sleep score. And the sleep score with the Aura Ring is, in my opinion, because I've worn a lot of them, the best sleep predictor out there. I've heard good things about the Whoop. That's the only one I've never tried. I don't know much about it, but it gives you a breakdown of your like your light sleep, your deep sleep, your REM sleep, and then the time that you're awake. It gives you a restlessness score, it gives you a sleep efficiency score, it tells you how much time is in bed, and then it gives you a total score.
Wow.
And I love, because we know that deep sleep and REM sleep are where you form your memories and when you repair your body.
And you grow muscle.
Thank you. I tell my
grow
teenage
heights.
children all the time, if you want to grow taller, if you want to grow stronger, there was a study done by Stanford University on basketball players at Stanford. And I think it must have been off season because they couldn't have done this during the season. That would have been not good. But they didn't sleep deprive them, but I think they let the one group sleep like 6 hours and the other group I think slept 8 hours. Sleeping longer actually improved their shot percentage by a tremendous amount. And of course I try to tell my teenagers this and they're not listening
That's why
to
I'm
me.
the shortest person in my family because I slept the least. Everybody's like,
And I'm
my
shorter
mom's
than you
not
because, yeah,
anymore,
I
but
didn't-
she was. My dad was a short man, but now that all makes also all the sense because that man never was asleep.
But anyway, what was I gonna say?
Oh yeah, the Nova ring, the Aura ring,
The Nova.
Nova,
The Nova.
Aura.
I think
Isn't
that's
that
what
like
they
a
told us.
vagina ring?
It is.
Yeah.
It is. Yeah. Okay. So yeah, totally pertinent. But I love that it gives that data because the deep sleep, the REM sleep, is where we repair and where we do all of the things that help us to live longer.
Yeah.
Whereas a lot of these other trackable devices don't give us that data. So something really cool is coming out in November that's going to be super pertinent. So we'll have to circle back around to it. But
I love that. So when you find that you have that, you can adjust things to change.
yes.
So that's where you get that data. You're like, okay, I thought I was sleeping great, but I'm actually not.
Do you know I actually diagnosed myself with mild sleep apnea with this ring?
So do you use a thing?
I don't use a thing. I feel like it's better when I use a million allergy medications, so my nasal passages are a little bit more clear. But it detects your blood oxygen concentration while you're sleeping. And I had lots of apneic where you stop breathing episodes when I first started wearing the ring, and I'm just like, oh crap.
That's not good.
I didn't know that. So I've made some modifications like to the way I sleep, the angle my neck is, like keeping my nose a little bit more like patent. But
Painted?
Patent,
Oh,
which
is
just
it
means
the thing
open.
like that? Do you
Yeah,
use one of
sometimes I
those
use that.
things?
If I feel really stuffy, I use that.
I want one.
I do. I've tried mouth taping, but I hated it.
I don't
my
like
God,
that.
I hated
I don't
it.
like
I hated
it.
it.
I don't want that.
And I got that advice from my 13-year-old. I was like, Camden, I need
Did he
to
try
go. He did it. It's so funny. I was just like, Camden, we need to go to the chiropractor. And he's like, no, I want to go home. And I was like, no, I need to go to the chiropractor. Mama had like several episodes where she stopped breathing last night. And I think part of it is like, I need to be adjusted. And he's like, okay, but have you tried mouth taping? And I'm like, you're 13. How do you even know? And he's like, and have you tried the breathe right strips? I'm like, TikTok? Yeah. TikTok.
Just it's gonna
TikTok.
come. It's gonna be in like a year and a half to 2 years, and they're gonna start treating you like you're old.
Oh no, that's Steven now.
Like
my junior.
Be careful. Don't do that.
Oh no, not that.
Oh no. And I'm like,
Oh, I haven't gotten
are
there.
you kidding me? I can kick you in the head. Like,
that's
tell
funny.
me to be careful.
That's funny.
Going downstairs and just weird random things. And I'm like, I don't even think that Vince realized that he's doing it. But it's just
He's
like,
probably just doing it in a
ew,
loving way. But I have noticed that I'm being treated like I'm like old and irrelevant.
Yeah, that's
way.
just that'll go away really quick. That'll
I
go
hope so.
yeah,
I hope so.
really quickly.
Because I told you about the jeans, right? So the other day, I don't even want to know what brought it up. I wasn't wearing them. And all of a sudden, my 16-year-old son says, you know, Mom, it really pisses me off when you wear those jeans and you roll them up at the ankle. I'm like,
Do you roll them? Okay. Do you roll them like
I roll them
this?
once, just like that.
Or do you roll them like the big cuff?
No.
Like I like the big cuff.
No, I just roll them the
You
one
do the
little
little-
bit because I'm a lot shorter than you and I don't need to shorten my legs more than they are.
I've never seen you do this.
No, my very favorite pair of jeans that I wear, like maybe this is where the pissed offness comes from. I wear them to almost all the basketball games, you know, because you've got like the Spirit shirt and then jeans.
Oh, yeah, this making more sense.
Right. And I was just like, but like all people my age do that, or all women my age do that.
Yeah,
He's
we
like,
do.
exactly. You all piss me off.
I want to come over.
I'm like,
I wanna come
when
over
we
with
were
my
having
rolled
this
pants.
discussion, he was wearing jorts. He was wearing jorts. Do we even know what jorts are?
I didn't know.
They're the most
What is
ridiculous
a
things
jort?
ever. So, okay, you know what a skort
Is it a what?
right? So, they're jean shorts that look like a skort, and they come down below their knees, and these teenage boys are wearing them.
Oh, wait, no, these are just like Jinko. They're like Jinko jeans except cropped. Like so if they went all the way to the floor, would they be considered wide leg?
Yes.
It's like if you took wide leg jeans and
cut
you
'em
chopped them off. Yeah. That was pretty rave. I used to wear Jinko. A lot of the boys.
But like he
don't
looks
wear
like
them.
this, and he's telling me I can't.
Does he have a shirt on?
I don't remember.
It's always hard to take them seriously though when they don't have a shirt on and they're yelling at me, and I'm like, you don't even have any.
But they're like,
nipple
I've got
hair.
one kid that won't wear anything
They won't
but
wear
Uggs
anything but-
to school. He has like a million pairs of like nice tennis shoes. And he's like, oh no, we don't wear tennis shoes this year.
Uggs.
He
Wait,
just wears Uggs.
boys in Uggs? Are they slide on Uggs?
Yeah, like the like
They're not like the cropped booty Uggs.
no, just wait for it. No, they're the like the,
Just wait.
they're the slipper kind. But yeah, it's like he has all of these like fancy tennis shoes and he wears Uggs to school every day. I don't know.
Well, you should sell those.
Should
This is
totally
completely
sell
off topic, but since she's here and I'm going to forget, did you get your boots yet?
Yes, I got them.
Did
I've
I
ordered-
not order a pair of boots?
I don't
thought
think you ordered them.
Why would I send you boots and
I
be like,
swear-
I love these. These are so cute.
I don't think you
Okay,
got
so
them.
because all of a sudden it
And I
came
don't
to
think
me.
you can wear
no.
mine because I don't think that we have the same size feet.
Okay, tell me, do you love they're Freebird? Freebird.
Freebird, I think.
Freebird.
Yeah. But I haven't found an outfit that I want to wear them with.
Oh, well, that's
You're
gonna be
gonna have to
really
help
easy.
me.
Oh no, I have the perfect one. It's a denim dress, but
Okay.
it's got the strap. The straps are wide. It's not like boobies. It's just normal. And then
Oh, I
it's
like the
denim.
booby dresses because I don't have any
Yeah,
boobs.
it's not,
so
it has the sweetheart thing. You
Okay,
know?
that's fine. I don't
And
like
then-
straight across because I
no,
look like
and then it's got a
boyish.
nice like zipper, like nice thick zipper, and it goes to like here, and it's got a little slip, but it's
that looks
denim,
fun.
and so you can see the like this piping thing. You can see it going down the. It was Amazon like $25, something like that.
All right, I'm gonna have to
Super
look
cute.
at it.
Love to maybe some rolled up jeans.
Maybe.
I think some rolled up jeans should.
That's what I'm
definitely-
going to do. I'm just
And then
going
you
to wear
should
them
wear
with
'em,
rolled up jeans.
so when you're
and I'm
walking-
going to wear them to the freaking basketball game.
Yeah,
The
clack,
first
clack,
the first
clack,
one of the
clack.
season. Actually, maybe I'll wear my sparkle boots with my rolled up jeans to the basketball game. I'll be
He's gonna
rolling
ask
in.
you to never come back.
Yes, and it's too bad.
Okay. We had a couple questions come in.
Okay.
And these are definitely the kind of questions that I find myself Googling at 2 a.m. once the house is asleep, not empty, but
All
asleep.
of a sudden, everybody's gone
Yeah, everybody's gone, 2 a.m.
in your head.
But it's like, it crept up. I'm trying to think back. So it was about 33, 34, 35, insomnia hit. And here we have, why am I suddenly having trouble falling asleep or staying asleep?
Okay. So that's super easy and it's super common and it happens to almost every woman and all of this I'm going to preface by saying if we're lucky enough to live old enough to go through perimenopause and menopause. So our hormones go through varying states of decline, but our progesterone very reliably declines much more linearly than our estrogen does. And it starts declining earlier to the point where we generally don't have any progesterone, or we have very little progesterone by the time our estrogen, it's on the decline, but it's kind of like this, if you know what I mean. Whereas progesterone, kind of starts like this and it just kind of goes like this.
That's what I don't have a lot of.
Right. Exactly. We talked about this. So progesterone, all humans have three hormones. We have progesterone, estrogen, and testosterone. Men and women just have them in different quantities. But we all have the same things. So for progesterone, it's kind of like our relaxation chill hormone. So think of it as a chill pill. You know what I mean?
Progesterone.
Yeah, progesterone. So when your progesterone declines to the point where it's very low or you really don't have any at all anymore, like the first time I got my progesterone checked, it was already like 0.2, which is almost nothing.
Then you can't chill.
You can't chill. So you have increased anxiety.
You're thinking more.
You lay in bed and you're overthinking. You have insomnia. Sometimes people even experience kind of like, it feels like heart palpitations. That is all related to a low progesterone state. And you could have a low progesterone state in very early perimenopause.
That's what I'm saying. It was, if I'm really thinking, I had
Penelope said it was like
33. I think so I'm 43. I was 43 when she was born, 33 when she was born. And I'm thinking it was like right after that everything started to just slowly change, but I was so unaware of it. I just thought, I have insomnia.
Right.
Now my brain, now I'm starting to think about all the stuff from my life and all the things in it. So because I was losing progesterone.
You were losing the progesterone.
I was losing my chill pill.
You were losing your chill pill. So the problem is when you were 35, 36, 37. You're 35, 36, 37. You go into the OBGYN or you go into your primary care provider and you tell them that you can't sleep. They're either going to tell you to take a melatonin, or if they're more aggressive, they're going to prescribe you a medication.
Yeah, for sure.
Or they might refer you to psychiatry. Those are the three things that usually happen. And this is where this whole vicious cycle starts. And this is like a crazy statistic to me. Most women in perimenopause get referred out to 5 to 7 specialists before they even realize that nearly all of their symptoms can be tied back to hormonal issues. So you go in, you're say you're 37, you go into the doctor. They didn't diagnose you with a progesterone deficiency and say, it would be really easy to take an oral bioidentical progesterone. No big deal. Let's see if this helps. Because unfortunately, nobody has that education from medical school or from, whatever. We didn't learn it. I didn't, and I can call myself out. Until I started going through this, I wouldn't have known that to tell a patient either.
No, yeah.
And so like I said, I feel like it's a blessing in disguise that I went through perimenopause and menopause pretty early, because at least I have this weird patient panel where nearly all of my female patients are around my same age. It's so bizarre. But I'm oh, I think I was given this patient panel because I can help all these women.
Can help them.
Yeah. So now we're having these discussions. I'm so sorry that you've been telling me for 10 years that you can't sleep.
And you're and I didn't pick up on it.
Yeah. I mean, I'll be the first to call myself out.
I love that. This is why you are here today, because you are authentic. There's just something about the information, and I'm the biggest skeptic. I've told you, we've talked about it. I was I have, what is it that I'm scared of the doctor, but really, really,
kind of
I'm terrified of, because I've been told that there are things wrong with me that were things that I knew were wrong. There's nothing wrong.
Right.
There's nothing wrong. It must be something in your life that's happening. I have another funny one that goes with that. But so progesterone.
Yeah,
that's pretty easy.
Progesterone. And just for the women out there that are wondering oh, can I take progesterone?
Am I too early? No.
Am I too early? So bioidentical hormone replacement, there's no timeline on when you need to start it. And there's no oh no, you have to start it all together. You can absolutely, your clinician can absolutely just prescribe progesterone all by itself, and you can see if it helps, and maybe it won't. So here's the thing. Like 30% of women are like, progesterone, oh my gosh, my BFF, I love it. I never want to live without it ever again. 30% of women are kind of like, meh. It's like, it's helped me sleep a little bit. Otherwise, like, I don't really notice anything, no big deal. And unfortunately, about 30% of women, the math isn't mathing, but you know what I mean. A third, are like, I don't really love progesterone. What else is out there? So if you're one of those people, and that's where things get a little bit more tricky, progesterone is what we call bioidentical. We know that it's body identical. It's super safe to take progesterone. The studies that we talked about in the early 2000s were on synthetic hormones that we used to use back in the 80s and the 90s and the early 2000s to treat menopause. We don't use them as commonly now, but we do still have to use them in women that may be progesterone intolerant, other progestogens. So, yeah. So there's other things you can do. You can actually try your progesterone in your vagina, and that may solve all the problems.
I've had progesterone from IVF. But so do you think they don't give you that much progesterone? I remember I could feel the chemicalness of it.
Yeah. I mean, progesterone is very useful in fertility medicine, and that's where we know it from. Or like a lot of us have taken progesterone-only birth control pills. So like I had been diagnosed a long time ago with a blood clotting disorder called factor V Leiden. It's super common in Caucasian people, especially of European descent. Like 10% of us have it. That's a lot. But it makes us more predisposed to clot. So if you have that, one of the things you cannot take is oral like synthetic hormones.
Oh, okay.
Because the risk of clot is really bad. So until I got diagnosed with this, I was taking birth control pills, just like every other person.
And that's the blood clotting thing that they talked about.
Yes, and that's the blood clotting thing. So I was sitting in my hematology oncology lecture one day, and they were talking about family history of blood clot, and then they were talking specifically about this thing called factor V Leiden. And I was like, my dad has that. And so I kept listening to the hematologist oncologist that was lecturing. And it was like, if you have had someone in your family with this, then you might want to be tested if you are a woman who's on birth control pills or if you're a woman who's pregnant or trying to become pregnant. And I was like, oh. Crap. So I went to my OBGYN, and luckily he already knew what it was. And it was kind of like a evolving thing back then. The test was actually pretty new, I think in the late 90s maybe for this. He tested me for it. And not only did I have one gene for it, I had two genes for it, which makes me super hypercoagulable, which is kind of scary. And he was like, whoo, thank goodness you never got a stroke.
Do you take blood thinners? I don't. Hey, tell me your medical stuff.
I don't take blood thinners.
No, but that's what not a blood thinner, but that's what someone, the coagulating, which has nothing to do with the hormones, but that's what someone would take asprin for. That's just my own curiosity.
And I do take a baby aspirin. I don't take like an actual blood thinner like my dad does, because he had a blood clot where I never have. Yeah. But back to the progesterone. So if somebody like me is like, oh, I have a blood clotting disorder, I'm a 25-year-old woman who doesn't want to get pregnant, then you can try the progesterone only treatments because they don't increase your risk of clotting. They don't. So yeah, I took that, the birth control that had progesterone only, and I hated it. It was terrible. Like, it made me feel terrible.
How? Can you describe that?
It was a long time ago, but it made me, I think I had headaches every day.
Okay, and so you felt that?
I felt headachy, and I just remember telling my then boyfriend or fiance, now husband, that I felt like I was just like a raging bitch. Like, it made me into a raging bitch, and I was just like, I can't take this. So I just stopped, and it was actually, he was my fiance, because it was right before our wedding, and I was like, screw it, let's just start trying.
Yeah.
We started trying for Steven. Yeah, so the rest is history there. But all of that to say, this is like that whole, everybody doesn't tolerate progesterone. So I didn't tolerate that particular, it was the mini pill. That's what most people know it by. Didn't tolerate that particular dose of a progestogen, but I can tolerate just fine this like kind of smaller, more mild dose of progesterone that I'm taking for my menopause.
I love that. That's all really good information that you're not going to find on the internet unless you're sitting down having a conversation, or you're sitting in on a seminar, you're listening, it just doesn't, or you're catching a blip of it on a podcast.
And I feel like even as a medical provider, even with resources that most clinicians use to look up medical stuff, I still found myself not finding the answers that I wanted, in terms of hormones for myself until I took the last course that I took. And then I was finally like, light switch. Oh my gosh, this is the best class I've ever taken. Like shouting it from the rooftops for all of the clinicians out there. Heather Hirsch Academy, like she's one of the like foremost leading menopause experts in the United States. She actually just sat on an expert panel with the FDA, advocating to take the black box warning off of estradiol cream, which we can totally get into too. But she's just really amazing, and she just did such a great job of breaking down how to understand and how to prescribe each one of those things to where now I finally feel comfortable. But the point is, you can't Google it. You cannot Google your way into finding the right answers, because I couldn't even do it as a clinician.
Yeah, no. Are there resources? Like, have you found any reputable, and we can add those to the,
Yes.
to the podcast information. So you have reputable like women. So like a lot of us wouldn't mind taking little mini courses. It's
Right,
like here's
right.
a 2-week course on
And I think she has a course for non-medical
for
people,
non-medical,
which is like
yeah.
just teaching,
That makes
which
more
is
yeah.
so incredible.
Yeah.
But so back to that original question, like who do I go to? So the North American Menopause Society, and we'll link that in the show notes, has a list of credentialed providers
Okay.
that have actually taken a test to show that they have the knowledge
Oh, okay.
to treat menopause. And if they're in that directory, then most likely they spent their own money to get
Yeah.
in that directory, and they really care.
And they really
So
care,
that
yeah.
would be, and that's throughout all of North America.
Yeah,
so
they want more information
Yeah, whether
if they're
in
doing
Canada,
it.
United States, wherever, Mexico, all those will be listed. And then the course that I just completed, I actually haven't filled out the thing yet, but she has her own directory of the Heather Hirsch Academy graduates. So anybody that has taken her course and is taking new patients can be listed in her directory. That's another place to look. And then what I've been actually, this is a really good one. We should put in the show notes, midi.com. MIDI, MIDI.
Okay, midi.com.
I think .com. Yeah.
I love
so they
that.
are a telehealth practice that only does midlife women's health. And by midlife, I mean like 30s, 40s, 50s,
30s,
60s, beyond.
40s, 50s.
Yeah, so they
Sorry,
do.
30-year-olds.
Yeah.
Knocking on heaven's door. Not heaven's door. Whatever.
But I mean, really, but perimenopause
hormone
can start in
door.
your 30s. So, you got to think about that stuff.
I swear it did, and I know that it's got to be correlated with like the mental health. I think that just aggravates
mine started I started in my 30s too.
And nobody believed me. I kept saying, I feel like it's my hormones. I feel like a crazy person. And I've always been that person, but this was like intensity.
For me, it was not that. But so I'm somebody that I've spent my entire life working out. I love exercise. I love fitness. I love everything about it. I grew up as a dancer. But I also grew up, like I remember taking a weight training class in high school. I remember taking weight training classes in college. Like I just love weight training. I love fitness. I love, love, love it. So I've had this lifetime of fitness. I feel like I've always had a decent amount of strength. And I remember completing a really hard program where I worked so hard. And I remember thinking to myself, it doesn't make any sense because I worked so hard and I don't feel like I'm getting any stronger and I'm so tired. And I'm just like my body composition isn't the way that it used to be. And it doesn't add up with the way that I'm eating, which was really clean. And like I was like nourishing my body, like I wasn't under eating, like I was eating a lot of food, a lot of protein, all of the right things, and exercising, lifting weights. I was literally dotting every I and crossing every T, and I was getting weaker and I was getting more tired.
Yeah, that's when if you're doing all of the things, and even if you're not doing all of the things and you're making an
Yeah, but
effort,
you're doing the same things.
yeah, it's like you can't, there's nothing, you've got to look for that extra help.
Yeah.
You have to look for that extra help.
for
So I think we answered this one. Where do I go for hormone health? OBGYN, your primary. How do I avoid endless referrals? I think that you're going to solve that by creating Woman's House. Or whatever you
Woman's
wanna call
house.
it.
I don't
Woman's
know.
house.
But for the meanwhile, while I'm still, invested
Yes.
in my current, my current
Career, yes.
career in HIV, infectious disease. I think that the resources that we just talked about are really good. The other thing that I tell my girlfriends is you can start by going to your primary care or to your OBGYN and asking them, or even calling the front desk and saying, hey, I am looking to start bioidentical hormone replacement therapy. Does X provider do that? It's a great place to start. Maybe they do. I mean, I'm an HIV provider, but I feel fully confident that I can take 100% great care of my women. And you wouldn't guess that.
And it was bioidentical, hormone
replacement.
replacement.
Yes.
It's not
And
the synthetic.
It's not the synthetic. And not to say that the synthetic is always bad. Sometimes the synthetic is the best option. And that's, I think, a whole other, podcast and, maybe even touched upon in the training that I was talking about. But I think that's where we start.
That's where.
Ask the people that you're already seeing, do you do this? If they say anything of the sort, then no. The next thing you do, and what I've literally been telling my girlfriends to do, is Google hormone wellness providers near me.
Functional. You told me. What was that word?
Functional medicine providers, maybe.
Mm-hmm.
But maybe not.
But maybe not. Yeah.
Yeah. So I don't know. It kind of depends.
It
and
just depends.
I think one of the questions I saw looked ahead, I think might kind of address that a little bit.
Oh, perfect.
But yeah, start with the people that you know and love, your providers that you know and love. And if they don't feel comfortable with it, then let's look for referral sources. And I've also, if you're watching this podcast and you know me, I am more than happy to post on my Facebook timeline, hey, all of my San Francisco friends, who do you guys love for your hormones? Because I did that for my Indianapolis friends, because half of my followers are from Indiana, because that's where I'm from. And I got tons of great answers. And then I actually also posted, so the best part of the course that I just finished is they have a small community of clinicians that have taken the course.
I love that.
And it's moderated by Heather Hirsch and Kelly Casperson, who's another, I literally, she is the coolest, funniest online physician, menopause expert that you'll ever listen to.
Say their names again.
Heather Hirsch.
Heather Hirsch.
And Kelly Casperson. Kelly Casperson has a podcast called You Are Not Broken.
You Are Not Broken.
And she is incredible and funny.
I love it.
Incredible
that sounds
and hilarious.
like the perfect podcast. You Are Not Broken.
Yeah, and I don't even remember what my point was.
I said that. Sorry. I said that. I was like,
No,
I feel
you
like
did
I'm
say that.
broken. I feel like there's something. Yeah. So.
Yeah, no, it's the perfect podcast. And actually it was Dr. Kelly Casperson. I was listening to her podcast, trying to get more information for myself, that shouted out her colleague, Heather Hirsch, that had this amazing training program for clinicians. And I was like, it's a sign, I'm taking it. And I looked at the price and I was like, ooh. And I was like, screw it. People need to know this information.
Yeah. I love that. I love that you're so passionate. Just all of the talking. It's you did the weight training classes in college. I love that you're a literal dedicated person. A lot of my experience has been, no, actually, I've had a lot of good experience with medical providers, but I've also just found some where I'm like, why are you doing this?
I mean, not everybody walks the walk. And so it's hard for patients to take someone seriously that's telling them to do something that they clearly aren't doing themselves.
Yeah. And I like that there's a lot of information, and that's why it's always good to do your own backgrounds and checks and everything. But that is one thing that's so nice about the internet and media and social media, is that we have we do have a lot of really good knowledge and information. And
Yes.
even if it's not information, even if it's just a little bit of something that piques you're like, that's what I should be looking up.
Yes.
Oh, I've been looking something completely different. So that's like the bioidentical, like those are the kind of things where I'm like, well, I haven't even been looking for that at all. I've just been, yeah. So sometimes it's just a matter of hearing
that one. And I think that the thing that's happened in the last 10 years, and it's probably been longer, but I feel like it blew up in the last 10 years, are podcasts. There are, like, you'll be hard pressed to find me in my car by myself where I'm not listening to an educational podcast, and I just love it. Like, I feel like I've gotten 10,000 times smarter by listening to really educated people on podcasts over the last 3 years than I did in my, like, bazillion years of college.
I love that.
I love it.
I love it.
Yeah.
I love that. Okay, for our next question, what's normal in perimenopause, menopause, postmenopause? Do we have the 5 hours of what's normal? What's just biology versus red flags?
That's a good question. So there's no normal. Everybody's different. So I absolutely have patients that I've been taking care of for a very long time. I've been at my current position or my current clinic for 13 years, and we don't shift around patients. Like, if they're my patient, they're my patient. So I've seen some people through their 30s all the way to their 50s now, which is amazing. And I've seen some women all the way through perimenopause into menopause with 0 symptoms.
I've heard of those.
Once in a while, you get, and I don't know, if it's a certain ethnicity or it's a certain, like what it is. But some women are like, I feel fine. Like, they're still a pretty normal weight. Their body composition hasn't really changed. They never really got hot flashes. They never really had mood swings. They didn't experience like crazy, like menstrual abnormalities, and they made it all the way through. They haven't had a period for a couple of years. And so there's that. But then we still have, now that I have this background in education, we still have a conversation about hormone therapy, because there are many long-term benefits that can actually be associated with risk reduction and longevity, even if you don't have any symptoms at all, which is really, really cool. So that's one end of the spectrum. The other end of the spectrum is like me or Leslie, where we started having perimenopausal symptoms in our 30s. Yeah. And, it can last for 10 years. You can be in perimenopause for like 10 years. And so the only thing that I can say that is like certain is that menopause is just one day. So one thing that I hear that, like, I don't know, it's like nails on a chalkboard for me. I'm in premenopause. Well, you're only in premenopause if you're like 12 or like 20 or like 25. Like, premenopause is basically like your ovarian and uterine function is perfect, and you're fertile and all of these things. Once your hormones don't act like they do when you're young and trying to reproduce, that's perimenopause. Premenopause is like, puberty to whatever. So then you have perimenopause. Menopause is one day. So menopause is the very last day you ever have a period.
That's so fun now.
It's just one day. But the fun, not so fun thing is, you don't know that you're postmenopausal until you look back and you're like, oh, I haven't had a period. So the definition of postmenopausal is you haven't had a period for 1 year. 0 periods. So menopause is one day. Postmenopausal is you haven't had any bleeding whatsoever for at least a year. And then you're postmenopausal. Anything after that is thought of as postmenopausal bleeding, and it's treated differently. So that's why that's important.
Okay, so if you are you haven't bled in a year, and then all of a sudden you do 3 months after a year, that is not normal.
It's not necessarily normal.
You should go get it checked out.
You should probably get it checked out. More alarming if it's been 5 years or 10 years. Like, super not normal. You know what I mean?
Okay.
Definitely a red flag. I was asked about red flags.
Yep,
so you're postmenopausal. You haven't had a period for 5 years. Either you're on hormone replacement or you're not, but nothing's changed for a long time, and all of a sudden you start bleeding. That's an indication that you absolutely need to go to your gynecologist, and they need to do an evaluation. So that's definitely a red flag. as opposed to what to expect, what's normal. Like, the sky's the limit. We already talked about, the insomnia, the difficulty sleeping, the nighttime waking up. All of a sudden, you will have to start waking up to pee, whereas you never used to have to, 1 or even 2 times a night. You can't fall back to sleep. Those are all progesterone driven. And then you've got the mood swings. You have depression or anxiety, whereas it was never present before, or you have worsening depression and anxiety where, you had it before and it was managed. Your hair and your nails and your skin start to change in not a good way whatsoever because it's all estrogen driven. Like every single estrogen receptors are all over our body. And when our estrogen starts to decline and we're in estrogen decline, it's like all of a sudden. So when I was in late perimenopause, and I did not know that this is what it was until I was on my second or third menopause class that I took. I had dry, itchy, scaly skin so bad that it would slough off every night. I literally felt reptilian. I still have a little bit. This is kind of gross, but I have
No, it's not
very dry, flaky earlobes, which can totally be a menopause sign. Frozen shoulder. So there's something called musculoskeletal syndrome of menopause. We used to send people to orthopedists and be like, oh, I don't know, something's wrong with my shoulder or whatever. Frozen shoulder is a sign of estrogen decline. You don't have enough estrogen.
Gross. What does that feel like?
It feels like you can't really move your shoulder. It feels exactly like what it sounds like.
Awful.
It feels awful. And then of course you've got decreased libido.
The pain in your vagina. There's a weird thing. And I was like, dang, I don't have to, you can't I don't know how to describe it. You can't itch. It's not an itch. It's inside and it's like a zing. And you're like, I just want to be like, what the fuck is that?
So
when you're pregnant, you can get away with doing all sorts of weird stuff and just be like, I'm pregnant. So you can mess with all your body parts.
Yeah.
But when you're sitting, I don't remember where I was. I was somewhere and I couldn't just be like,
like a dude.
Yeah,
like a dude because they can.
Or because it'd be like, are you okay? What is happening?
Yeah, so there's something also called genitourinary syndrome of menopause. So that's where everything down there starts to just kind of
malfunction.
This is a terrible, terrible thing. But basically,
I hate this.
Your vagina kind of just starts to dry up. So
here's our vagina.
Pain. Yeah, here's the vagina. Actually, this is really important. So when we talk about genitourinary syndrome of menopause, it's really important to know that the bladder is kind of all right.
And you can pick it up if you want to. Pick it up.
The bladder is really just kind of right up in there, right? It's up against the wall right there. So when you talk about genitourinary syndrome of menopause, this is really important. And this is something that I learned that I genuinely think can save people's lives. And any woman can tell another woman and save their life. So in women's usually 70s and 80s, we start getting really frequent urinary tract infections.
I know about those, yeah.
And when you're older, sometimes they end up hospitalizing you for it because you get urosepsis, which means that the bacteria from the urinary tract infection goes into your bloodstream, and sometimes you can have mental status changes and all this stuff. And a lot of older women die of this. If you have a prescription of vaginal estradiol and you put it in your vagina from menopause on, you are basically preventing that from happening.
Oh.
So if you have a woman, if you have a mom, you have a grandma, you yourself are getting frequent urinary tract infections, instead of going back to the doctor again, okay, you got to drop a urine and we're going to give you another antibiotic.
Antibiotic, which will kill your gut health.
Ask for vaginal estradiol. The beautiful thing about vaginal estradiol, because there are still some red lights to systemic estrogen in some people, but even in patients with current breast cancer, they can still use vaginal estradiol because it is not systemically absorbed. It means that it stays where we put it. It stays where we put it. But it
doesn't go through the lymphatic and all that
correct.
stuff.
It'll just stay right there. It'll kind of bring your vaginal area back to where it was. So if you have pain with intercourse, and that's a real thing, especially starting in your like late 40s, 50s, and 60s, vaginal estrogen, vaginal estradiol.
Interesting. Just
Yes.
nice.
Yeah.
Why don't they, like, there should literally be just a little book of, and again, like, you don't even have to care. I know you're not going to care. I wouldn't have cared when I was 18, 19, 20. But in like college age, like, there should be more information.
I mean, that's the thing, right?
even,
Like,
like, when you have your
don't
baby.
care until you care, I guess.
Or like your baby. Well, at 30, there should be forced literature on like forced. We force so much literature on ourselves now.
Not force, but like there's guidelines for breast screening. There's guidelines for pap smears, and there's guidelines for colonoscopies. Why can't there be a guideline where like at 30 or 35, like this is what to expect in the next 10 to 15 years?
It's
like
the Laurie guideline.
It's the Laurie guideline. Yeah. So
I am one of your biggest fans. I don't think if you haven't noticed, I've already made you the CEO, CFO of a whole new like business. And you're gonna have this. I really think that we have so many warnings, and okay, we're talking about taking the black box warning. That's amazing too, but now we need to implement a new black box warning that is like, inform your patients of what is coming.
Yes.
Oh, you don't get it. That's fine. You're not at 30. Are you experiencing insomnia? Blah, 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 blah. Like, I don't know, maybe even 29. Oh, nope. Okay. We might find that, it's tied to like, maybe you can get thrown into early perimenopause because you have unresolved trauma. I think that
there's a lot of things that can do it, for sure.
Because you can increase your stress just by having realizations. It's kind of like they say, what is that? The I don't care button anymore goes away.
IDGAF.
Yeah, that button goes
Like
away, I've
IDGAF.
heard. Is that a real thing? Because your progesterone, they say that a woman, in not a medical sense, but in more of a therapeutic sense, it's like, we've been so mothering for so many years, taking care of all of our people that are important to us. And then it makes sense. You talk about this progesterone that starts to go away, the chill pill. And it's
I think you just hit the nail on the head.
All of this stuff, and it's like,
we don't care.
You don't care about me.
Like, I don't care either.
I actually literally see that you do care about me, but you can't care about me in a way that my progesterone had me caring about everybody.
Everything.
And then you start to see all the things around you, and you're like, okay, well, it's not just husbands are getting this. It's families are getting, and it's like, I think that there is a definite tie to it, because, and then if you're not sleeping because you're low in progesterone, we know what insomnia does to a brain.
Absolutely.
It can make you feel like you should be institutionalized.
The most important things you can do for your health, period, is get appropriate sleep. Period. Yeah. End of story. And menopause makes it almost impossible. And I don't even know, like, because it's the most common symptom in menopause, I forgot to mention it. Like hot flashes and night sweats. That's the other thing that wakes people up at night. So it's not just the progesterone. All of a sudden we have this like estrogen decline going on. So we were having trouble falling asleep because of progesterone. And now estrogen comes on in and declines down. And you're getting hot flashes and night sweats at night. So they wake you up and keep you up.
I thought, and definitely no, because obviously anytime something's going wacky inside of me, I go into like investigator mode. I'm one of those people that can't just let it be. I have to figure it out. What is wrong? Like, if I can fix it, I'm going to tell me what it is. I just wrote this
thesis because this is what happened. Yes. My name is Leslie and I like synapses.
Yes, I need to. Yes, exactly. It's, wait, what was it? I was saying something.
Sorry, it's your synapses.
No, it's literally going to go into this. It was am I losing my mind? Am I actually, literally, this was a question that someone put. And I know I'm going to come back. I know I'm going to come back to the thought that I was having, but when I smiled at you, I was like, I can't believe this is my next question, because it is tying into the whole, if you have some underlying trauma, I'm not a medical professional or anything, but I'm going to tell you, I think it does. I think it does. And so I'm going to ask you, do you think that it could aggravate your both symptoms? Like
It's gonna make whatever
beget
was
the other.
Yeah, I mean, it's going to make whatever was already there even worse because you're in this whole. So I kind of think of perimenopause as kind of like puberty in reverse. And we have children who have gone through puberty and we know what that looks like. It's like it's crazy, right? So I already told
Crying
you
in the floor of a shower.
Yeah,
You're like,
no big
what
deal.
is wrong
Like that's
with my
just
child?
yeah.
Who broke you?
Exactly.
No.
It's just because of like, and for
Same.
like we've
Yeah.
got boys who have gone through puberty. So it's just like, whoa, like I've literally used the word like that was a spurt of testosterone, like on the field or on the
Whiplash.
court or like what's going on,
Yeah.
But it's like puberty in reverse. So like you've got the progesterone going down, and then you've got the estrogen that's going down too, but it's going down like this. So when this is off topic a little bit, but when you get your doctor to check your labs and they're like, your estrogen's perfectly fine, everything's great, like it's all in the normal level. Well, I mean, they just got a snapshot of 1 second of one day. So it could be like your estrogen level could be like 300 and something at one point during the day, and it could be like in the tanks later on in the day. And that's what's making you feel like you're having those like volatile mood swings. And it continues to go like this in a downward pace until it goes away. And I like to tell my patients when I look at their labs and their estrogen's nothing and their progesterone's nothing and their testosterone's nothing, I'm like, your hormones have left the building. They're never coming back. That's what I tell them. Because most people actually don't understand that the definition of menopause is hormone deficiency. Your hormones are gone.
What happens to that organ? Does it just like what happens to it? It's just does it calcify? Does it petrify? What?
I don't think it petrifies, but I mean, you're right. It's not at that point it's kind of like an appendix.
Is that the one that's in that's this one?
What,
the hormone the
are you thinking your thyroid is right here? Your ovaries are right here.
Yeah, but so the hormone producing organ, do they come out of everything?
I mean, you're mostly talking about ovarian.
Okay, we're mostly talking about those.
So yeah,
okay.
But
I do remember what I was thinking.
Okay, good.
I was waking up with crazy night sweats.
Yes,
the craziest night sweats I've ever. But I was still having them in the daytime. This would have been late 38, 39.
Yeah, I mean that's your estrogen.
And I thought I was
crazy.
reading, I was like, it's the wine I was drinking. Which again, it does correlate. That's one of those things where I'm like, it all really goes side by side. And I realized that when I had stopped, because the blood cells get flattened, and so I don't know, they don't move, and so your body gets hot quicker. But what I realized was even after I cut out the wine, I was like, well, I'll just quit drinking wine for a month. I'll just see what happens. And it's like, no, there were still the night sweats.
There. Yeah.
And so but I would never have thought, because I was so young.
Right. And like, I mean, like women will report like sweating through their sheets so bad that they have to get up in the middle of the night and change them.
Yes. And then you're freezing.
Yeah. And
because
then,
I keep it at 65.
That's just normal. Like
it's
that's
65 in my
So
bedroom.
we've got we have, a whole generation of people that are like, okay, well, I mean, that it just is what it is.
If somebody had talked about this, like, a yearly appointment, like, okay, are you having night sweats? Well, that you drink wine or alcohol. Okay, well, yes, those two things can correlate. But
and drinking alcohol definitely can make hot flashes worse.
but it shouldn't. I mean, it was crazy. Yeah. Just full drenched, full sheets are drenched. Everything's
and it's
got to
just
get
crazy
washed.
How many people don't realize that this is all tied together. And even when I'm educating my own patients on it, like this sweet lady, I started her on hormones on Wednesday, and I was with her for 35 minutes. I have the luxury of having a decent amount of time with my patients, which is like, I don't take that for granted. I'm super, super thankful for it. But we were there for 35 minutes. And at the end, she goes, well, what about my hormone imbalance? And I was like, I just told you you have no hormones. There's no imbalance. Like, there's no imbalance. You don't have any. And she's like, oh, because she was probably just quoting something she saw on the Google.
Yeah.
And I'm like, no, we're
right
addressing
off.
that. Remember, we're starting your progesterone and your estradiol, and then maybe down the road we're going to start the cherry on top, which is the testosterone. We just talked about all of this.
I love that. Okay, on to the next one. What blood tests should I ask for? Best time of, and then I'm going to say one thing and then you'll answer it. Best time of the month. How do I interpret results and advocate for myself? Okay, when we were talking about the little things and it's like you're like, well, maybe you just got tested at this
Right,
point.
right.
You've seen those little snazzy, and now there's even a DJ that anyway, I saw him and I was all,
A
wow.
DJ?
Yeah, there's a DJ because he travels so much and he's always being picked up in helicopters. He was marketing this product for whatever reason. But it was a doctor for somebody was like, okay, now put it here and then now just push. And then you
Oh, was
saw
it
there
a
was a little
continuous glucose monitor?
No, there was a little vial thing and it filled up and he was like, here. And then he's like walking off to his helicopter. And I know that a lot of people are a lot of women are peeing on that thing to see where their hormones are that day. But that that one really did pique my interest.
Okay, so wait a minute. But you're saying it was a dude.
It was, yeah, DJ Diplo.
Were they testing his testosterone, maybe?
No, they were testing it was the whole thing, test your blood. Yes, your hormones. Test your blood. You can test them at every time. You don't have to go to the doctor once a month. You can now.
Never seen.
I can't wait. We're going to add that. I'm going to find that clip and I'm
Yeah,
going to
I have no idea. But okay, so in answer to your question, you probably shouldn't try to interpret your own labs. So I know the question was like, how do we interpret them? Like, what do we do?
I'm going to find this.
So here's the thing. If you are in perimenopause, which is the most confusing time of life, in my opinion, other than probably puberty, it's difficult to interpret the labs. It really, really is. There's not necessarily a best time to do labs as long as the person interpreting the labs knows what part of your cycle you were in. Like, you know yourself, okay, yes, it was 7 days before my period. If you tell your provider that, then they should be able to look at the labs and interpret them appropriately. So, like, they may have, I know that there's medical providers that love all different types of things. And like I kind of alluded to before, I've taken several hormone health courses at this point. And I've learned from clinicians who love this Dutch test where, it's a urine test and you learn about all the different metabolites of all the different estrogens because there's not really just one, there's several. And it's very complicated. And honestly, a lot of other really smart menopause specialists are like, you don't need that. So it's like, if you ask 20 cardiologist the same question, you're going to get 20 answers. You know what I mean?
Yeah.
So there's no really right answer about that. And so if you have a clinician that's like, I want you to get your labs drawn on the first day of your cycle, then do what they say. That's fine. Whatever, because they know how to interpret them best that way, and that's fine. If you're going to a clinician and you're asking, can I get my hormone panel done? And then my son is calling me. So hopefully he
okay?
remembered that he was supposed to go home with a friend today.
Well,
He'll be fine.
Are you sure?
Yeah, he'll be fine. So you want to just take a peek at the lab requisition before you get your labs drawn. Like, did they do bare minimum? What I think is important is progesterone, FSH and LH, those go together, estradiol, testosterone, free testosterone, thyroid panel. There's other ones, but those are the ones that you're kind of looking for to make sure that your clinician knows what you're talking about. Because maybe if they just are checking, I don't know, they might just check like a TSH, which is your thyroid. They might check a hemoglobin A1C, which is your sugar.
They love to test your thyroid.
Answer
it, of course.
But yeah, so those are the labs that I would just kind of like peek at. Like, so if a friend texts me and is like, hey, like my doctor only checked my thyroid and my hemoglobin A1C, I'm like, okay, well then they're not really checking for like female hormones. They're just checking in general to make sure, like, are you developing prediabetes, which is super important. They may check an insulin level to see if you still, if you've got insulin resistance or whatever. That's super important. They may check your thyroid, which is also important, but those aren't the only things.
That's like all I was ever tested for. I think
I I hit the nail on the head,
I've
right?
told
Like,
you
that's
that
what
like
they.
so many times. You're like, have you had your hormones? I want to read your blah blah blahs. Like every time I get sick or there's something wrong, like when I had COVID, I'm like, Laurie, look at my labs, look at my diet. I'm like, you're like, no. And again, you gave me some recommendation on a product, and I used it, and I literally was like amazing the next day. I trust a lot of what you say. So we really don't
I'm gonna
need
go
to
back to
be
that question.
investing in the
Really,
blood thing,
no,
though.
don't worry about the blood
Don't
thing.
buy your own blood tester just because you saw it on TikTok.
The number one thing that I see in my own friends
Yeah.
is they for some reason they check their LSH, their LH, their FSH, and their estradiol. They don't check their progesterone and their testosterone, and those are the two things that like are usually like you can interpret really easily. Like if somebody has no progesterone and they're 43 years old, give them some progesterone.
Yeah.
You know, if they have absolutely no testosterone, they're like, oh my God, I have so much brain fog and I feel like my strength is declined and I'm super tired. Like they might benefit from testosterone. Yeah. And these are things that are like easy to interpret.
Which is the sex one? Which is everybody wants to know.
Libido?
Which is the one? Yeah, which is the one that makes you want to have sex?
It's your testosterone. It's mostly your testosterone. So that's the third hormone. We talked about the progesterone. We talked about the estrogen. And so the testosterone
How does
actually.
testosterone? What movement does it do?
I'm going to tell you.
Okay.
So testosterone is more like a slow death march. So when we're about, I think like 25 or 30 years old, we have our peak amount of testosterone. And you can kind of like tell, right? Because that's when women
that's when
and
my
men
son was conceived.
are the most
Let's
sexually
have a
active.
baby.
Like it's like
Yeah.
yes, and we were designed that way to procreate.
Yeah.
Like we were designed to want to have sex so that we can procreate. But around 25 or 30, it just naturally starts to fall very slowly. And then sometime between like 35 and 45, if you're like me, all of a sudden my testosterone is like zero. I have zero testosterone in my body by the time I was, I think, 38.
Curtis always would say, well, I think not just my husband, I'm not going to throw him under the bus, but it's always like in the movies. There we go. In the movies, it's like, oh, she's in her prime. She's a cougar. All she wants to do is like, rawr. And I'm waiting for that one. When is that? When does it come back? Like, is it just like it's 65, 70? You're just like,
it's actually really funny that you say that.
does it come back?
So I learned something recently because I said, I'm in this like community where they have like calls every month and there's a Facebook group and stuff. And somebody had a case with a 70-something-year-old woman who was not on testosterone replacement and her testosterone was quite normal. And I learned that for some reason in your 70s as a woman, you have this like uptick in your testosterone. In your 70s.
Okay. All right. I got to play in that
Curtis
decade.
is talking about.
I got to play in this decade. What am I going to be doing in 2050
we're
or whatever
going to
that
be
is?
climbing mountains because we're going to have all this testosterone.
No, Kilimanjaro.
Yeah.
I've talked about Kilimanjaro on
Let's
the
do it.
podcast.
Yeah.
It takes like 7 days just to walk to the base.
Never mind.
From where you like get out your little car, they're like, see you at the bottom of that in 7 days. And then it's not that much to climb it. I think it's like 4 days.
We're not going to be doing
something.
that, but we'll figure something out. But isn't that funny? But as far as this whole like, oh yeah, she's in her prime, she's a cougar, she wants it all the time. Like I genuinely
She wants
think,
a husband.
I genuinely
That's what she
think
wants.
that's a Hollywood thing.
And she got divorced, and
or
she's
it's
like,
a divorce thing, so you're just trying your best.
yeah, it's just a Hollywood thing. Sorry, men.
No, I don't think that that's it.
There, men everywhere. Sorry, I still have more questions. Okay. Okay, so there's not a best time of the month. Your provider will already be determining on. They'll know when to test. That's their thing. You do not need to interpret your results. Don't advocate. Yeah, you do advocate for yourself. Don't take your. And I didn't. Even when it's like you're fine. I advocated to my friends. I still spoke to someone about it.
And somebody is going to have a hormone provider they love. Like if you have a social network, someone in your social network is going to have found somebody.
Join women groups
that they love.
Join women groups. There's all sorts of groups for women on social media.
Yep. Just today, I got a text from one of my very best friends. have been advocating for her. I'm like, okay, get your labs drawn. She's emailing them to me. I haven't seen them yet. But her PCP said, well, yeah, it looks like you're perimenopausal. So, I mean, it just kind of is what it is. Like, that's what the advice was. And she's like, well, what if I want to start hormones? She said, find a med spa. Her PCP said, find a med spa. So I don't know where the disconnect is, where this medical professional all of a sudden thinks the only medical providers that prescribe hormones are med spas. But I don't feel like that
You
was
go to
an
your
appropriate
med
answer.
spa for your Botox, for your facials, for your lasers, for your peels.
Right.
You don't go. It's not, what is it, like 7 or 10 years ago where you go and you get your pellets at the med spa at the country line,
Can we
county
just
line
talk
or
about
whatever.
pellets right now since we're talking about them?
Yeah, tell me about them because they freak me out.
You're exactly right. So before this whole big, incredible movement where all of these amazing, mostly women doctors were like, hell no, we're not standing for this. We're going to get really loud and we're going to advocate for ourselves and we're going to learn and we're going to teach and we're going to grow our army of clinicians that knows what they're doing.
Mm-hmm.
Before that happened, just like 10 years ago, 7 years ago, like you said, the only way around getting hormones into people were the pellets.
Mm-hmm.
Pellets are not FDA approved. So let's think about it this way. If you take hormone therapy, most of the time you are getting the exact dose that you need on a daily basis. So if I were to my go-to regimen that I know is the very safest for my particular patient population is progesterone orally and estrogen through the skin, usually in a patch, maybe in a gel or a cream, with or without testosterone in a couple different ways. The pellets give you a 3-month supply of maybe all of those. It could be testosterone, estrogen, and progesterone. It could just be testosterone. It could be testosterone, estrogen. They can do whatever they want.
Yeah.
And that's how they market themselves.
I do what I want.
We can put whatever you need in this one thing, and we only have to change it 4 times a year. Yeah. And we cut your little booty open, and we insert it.
Did you do it?
No.
I didn't either. I was so scared.
No, I've never done it. And so the problem with pellets is that you end up with super therapeutic levels of hormones, which means way too high of levels when they first get inserted. And for a very transient period of time, they're probably good levels. And then you're back to square one where you don't have enough. And then the vicious cycle keeps continuing. And the other problem is the med spas or the places that really push pellets as the only option for hormone replacement therapy are generally
not
they're making a lot of money.
Yeah.
So
a buy one get one for your friend. Come have a pellet party. You clearly see I'm not.
100%.
You can't take
100%.
them out. It's like the quick fix that why don't you go get them pellets like your friend has, and then we'll have all the sex. That's what it was.
So
I feel like that's
what
where it started.
But here's what it does.
This was like 28, 30 years old, and you got friends who were like, I don't want to have sex anymore. 33.
Get the pellet.
I don't want to have sex.
The pellet.
Get the pellets. It changed my life.
Yeah, so most of them are testosterone, and what it does is it gives you testosterone levels that should never be in a woman. Mm-hmm. And it burns out those testosterone receptors. So then if the woman were to go and get an appropriate dose of testosterone, like say an appropriate dose of testosterone for a woman is about 1/10 of a man's dose. Mm-hmm. So like there's a prescription called Testum that I prescribe to my men a lot. You put 1 packet on a day, done and done. Women, I can prescribe it to them also. Unfortunately, it's not covered by insurance because, of course, we don't cover testosterone for women like Australia does. Australia has all kinds of testosterone for women. They're living their best life. Appropriately dosed. We do not. So I have to be like, take this tube and put a pea-sized amount on your finger. Make it last 10 days. So that's like how you could appropriately dose testosterone for a woman. And that's great. And honestly, it's not that expensive because you're getting like a male box of testosterone and it'll last like 300 days. So like however much it costs, at least it's like almost a year's worth. Whereas with men, it only lasts for a month. But if a woman's been using pellets and then maybe they lose their provider because I've lost my provider 4 times in 2 years. And then they go to a new provider and they're like, oh, goodness, your testosterone level is 500 and it should never be really above 80, maybe 100, not really much more than that. I can't treat you. Or I can't treat you until your testosterone level comes down. So say their testosterone level comes down. They feel terrible again. And then they start the appropriate dose of testosterone, but because their receptors are kind of burnt out, they don't feel any relief. And that's what the pellets did.
I watched it. I watched it happen.
Yeah, me too.
And now I'm looking back and I'm like, it didn't fix anybody's
No, I mean, I'm
relationship
so
at
glad I didn't go down that route. I'm so glad.
I have that, so whether I'm BPD or not, or all symptomatic or whatever, I get that rage. I get that like rage of emotions because I wasn't taught how to regulate emotions.
Yeah.
Nobody did in my family. So testosterone is very scary because then when I'm raging on it, I'm like a roid rager.
Yeah.
And when you're horny, you're like you're like raging.
But if you have
like,
if you have none, and then you get an appropriate dose, it shouldn't do any of that.
no, and so that's why I was always scared of the pellets because I had done lots of different testosterone. Like I've done creams, I've done injections, and I was like, man, you are putting that in your body and you can't even take it out.
I mean, yeah. So the other problem with it is it's a guessing game. So if you're doing a pellet for your very first hormone ever, good luck.
Yeah.
Because most of my women that I start on hormones, like the dose that I start on is not necessarily the dose that they end up feeling best on.
No.
I might have to decrease it. I might have to increase. And we may have to change it to a totally different formulation several times over before they feel their best. And if you're giving somebody something that is going to be stuck in their body for 3 months and it's just like, well,
can you imagine you're already raging against your husband and now you're going to shut yourself up with some more? He's like, that didn't fix it. What are your options for hot flashes, night sweats, weight gain, brain fog? Is it only hormone replacement therapy? How long does it last?
okay, that's a lot of questions.
It's a lot of questions.
And I want to go back for just a second because we probably pissed a lot of people off by talking about pellets and that they're not the safest option. Everybody needs to do,
Yeah, of course. Yeah, this is just a podcast.
What's best for them? I'm a clinician, but
We're
I'm
just
not your
giving our-
clinician.
yeah, we're
but those are my opinions.
Yeah.
That's my strong opinion.
Yeah. You're a person. You're allowed to have I think as anybody.
Yeah. I mean, that is just what I would tell my patient.
Yeah.
If she walked in and said, hey, I went to XYZ clinic down the street and I think I'm going to get a pellet, I'm going to be like, okay, that is one option. Let me give you my options.
These are the options.
Okay, so hot flashes, night sweats. So there are non-hormonal options for hot flashes and night sweats. One is called Veoza. It's pretty new. One's called Brisdel. Brisdel is actually a baby dose of Paxil, I think, which is like a sister to Prozac. Those help with vasomotor symptoms of menopause. So they don't help with all bone density and all of these
helping
things.
for that.
It's just helping for those vasomotor symptoms. So that is one way to address that.
Vasomotor
being hot flashes and night sweats.
And is that vaso? What is that? What would that?
It's vascular.
Vascular.
Yeah,
okay, so
it's
it is.
vascular.
It has to do with that. Okay.
Yeah.
So you do have options for hot flash.
So you have options for that. And then estrogen itself is FDA approved for hot flashes.
What about magnesium? Have you heard any of that stuff? Magnesium?
Magnesium is great. I love magnesium. I don't know so much that it helps with hot flashes. Back in the day when I didn't know any better, I told my patients get some black cohosh. Black cohosh is a supplement that can help with night sweats. So that is a over-the-counter supplement that may or may not help.
Yeah.
As long as it doesn't interact with your other medications, that's an option if you're somebody that just doesn't want to use hormones. But estrogen absolutely will stop the night sweats at the appropriate dose.
Yeah. Weight gain.
Okay, so that's a tough one. And just on a personal note, I did pretty well, and I wasn't like the order in which I started my hormones is not necessarily the order that's always recommended, but it's just what worked for me. At the time, I wasn't having really any hot flashes or night sweats or really any estrogen related symptoms. I actually had too much estrogen for a while. Or not really too much estrogen, but not enough progesterone and a lot of estrogen. So I started progesterone and I started a small dose of testosterone, and that really helped me with all the symptoms I was having, including like my strength and my body composition.
Yeah.
Like it helped me to kind of regain my body. And then remember, like, right when I found out that my estrogen, like my FSH and LH, which are predictors of your ovarian function, basically no longer functioning. And my estrogen was like gone. And then I was like, oh, I haven't had a period for over a year. And then it was like, I don't even know what happened. I just started getting these fat cells all over my body that had never been there before. And it happened really, really fast. And this was also almost 2 years ago, before I was just like, I have to learn about this. I have to educate myself. I've probably spent the better part of the last 2 years, like, with classes and diving deep into everything hormones. But I didn't start doing that until I realized my estrogen was gone. I hadn't had a period for over a year, and I was like, oh, crap. And because I had all the way back to this blood clotting disorder, because I have this blood clotting disorder, I didn't know if I wanted to take estrogen. I didn't know if it was safe for me. And even though I had clinicians telling me it was safe for me, I was like, I got to do my own research. I have to know for sure. So if you start on, and this is a maybe, everybody's different. If you start on a full BHRT regimen before you're fully postmenopausal, you may be able to avoid the weight gain, at least some of it. I started gaining weight very quickly because I took my time to decide if estradiol was safe for me. And just as an aside, I can tell all of the people that have blood clotting disorders, but they've never had a personal stroke, that transdermal estrogen, meaning through your skin, bypasses the clotting cascade, bypasses your liver, so you don't run the risk of increasing your risk of blood clotting and stroke. So I feel very confident as someone that has both genes for blood clotting disorder that it's safe.
For you, yeah.
But I had to learn that. And in the time that it took me to learn that, I went out to LA and I took a course in September. And it was a very educational course. I loved it. And by the time I had come back, I called my provider and I was like, I need estrogen right now because I've gained like 10 pounds. So, and this was literally just in 3 months. And I was just like, what is happening? You know me, exercise all the time, eat pretty well. And I just packing on the pounds.
Everything on paper.
Yeah. And again, like, I feel like it kind of like, once I got the estrogen on board, like I stopped gaining weight, but it didn't help me to lose the weight. So I started looking at alternate therapies. And for me, that is natural peptides, bioactive peptides. And, we can talk about those some other time.
We have to talk about all of that.
We have to talk about it. But that is what actually helped me to lose the weight, Yeah. So,
I've started taking them. Boo. Yes. So we'll definitely have to be talking about them.
Yeah, we'll have to talk about them. But yeah, the the bioidentical hormone replacement didn't like necessarily help me lose the weight. It just helped me to prevent gaining anymore.
Yeah. You were able to catch
it was
that.
all and so the warning sign that all of a sudden you're in estrogen decline is if you have a belly and you've never had a belly before. Like most women have more fat like around their hips and thighs. If your fat starts redistributing and all of a sudden you have a belly, that is an estrogen decline situation.
Not cortisol.
Or it could be cortisol too.
Oh, I was going to say, because
sure.
everybody says cortisol. Well, I didn't know. I was
Yeah. No, cortisol definitely can cause belly fat too. But if it's like that time and you're just like, what's going on? Like that's what happened to me. Like I would look down at my stomach with my seatbelt on in the car and I was like, that's not my stomach.
Oh, that's awful.
It's not my stomach.
It's just not fun.
And it pissed me off.
Especially because you're working at it.
I've worked out since I was 4 years old.
Yeah.
As a dancer, and then into everything else.
You've been active your whole life.
My whole life, and nothing changed.
It didn't make any sense.
Yeah.
Next question. What is brain fog? Are there options?
So
brain fog is real. I'm not a medical professional.
Brain fog is real.
Real.
I have a really personal and pretty scary story.
Yes.
So I want to say 3 years ago. It was before I started any hormones, and this is what brought me to, like, I got to figure it out. I got in 3 car accidents in the span of, like, 3 months. One, I just backed into a mailbox. Like, it came out of nowhere. The mailbox came out of nowhere.
Yeah.
One, like I was sitting at a red light and all of a sudden I guess I thought it was green and I went and it was kind of like a fender bender, not that big of a deal. And then one was very serious.
Yeah.
And it was my fault. And my husband's like, what? He literally was like, what is wrong with you? Like, I even think that he mentioned maybe dementia, like early onset dementia, or like he genuinely, because like I said, he's a physician. He thought something was wrong with me. And in that time span, it was like COVID-y still. It was COVID-y. So I was like, maybe it's COVID brain fog, right? Because I had COVID like 3 times. I'm a medical provider. I get exposed. Like I never had it really bad, but I was like, maybe this is long haulers. Maybe I have COVID brain fog, all of these things. And then we had a tragic death in my family. And I just thought, maybe this is grief.
All of it.
Maybe this is just sadness. Just so sad, you know? And so, like, it was all of those things. So even as a medical provider, like, I wasn't like, this is all hormones. Like, this is COVID. This is grief. This is a million different things. And then, I don't know. Like, I think I was just like, I'm just going to go. I'm going to get my hormones checked. I'm going to see. And that's when I found out my progesterone was nothing. My testosterone was nothing. Started on progesterone, started on testosterone, felt like a whole brand new freaking person. Quickly.
I need to go.
Quickly.
I have a prescription. I just have to call the pharmacy. Because it's
like
a compound.
I felt, and it went that way until my estrogen, declined. And then of course I had to like figure out the estrogen situation. And, it's perimenopause is, you're never going to like put a Band-Aid on it and get through perimenopause. Like it's always going to be an adjustment thing until you're fully postmenopausal. Then you might be able to cruise along for a while.
Yeah.
We're
going to talk we're going to have you back on because there's like
too much
I'm doing all of the we're going to get all the questions in, but there's so much that it's like we're not able to really go into each of these questions.
Right,
and there's
and
so
I could,
many
like,
more
for whatever
questions
reason talk about it forever.
Well, yeah, but I think that so many people could listen to about it forever. What is the difference between birth control pills as hormone therapy versus bioidentical? I think we did talk about
we kind
a lot
talked
of that.
about that. Yeah. So
we did.
Birth control pills are always synthetic, and birth control pills are in a higher dose. And so obviously if you have sperm in your life and you are still of childbearing potential and you need to have a form of birth control, then birth control pills may be a decent option for you.
That makes sense. So if I wanted to still be having kids, I'm 43, so say we weren't done, I would look at the birth so we weren't interested, but we were thinking.
Like
I don't want to get pregnant, but I could potentially one day. I would be taking, that would be the route.
Potentially, and it could help or it may not.
That I would talk.
But one reason why you definitely would consider birth control pills over just regular BHRT is if you have really heavy bleeding. Birth control pills really, because remember when you were a teenager maybe or early 20s and you had heavy bleeding and then like your friend or you or somebody got prescribed birth control pills, like I did. Yeah. I got prescribed birth control pills for heavy bleeding and it controlled it. Heavy, painful periods. So another thing that happens when you are in perimenopause is you go from having your normal-ish periods, whatever that looks like for you, to probably heavy, painful, more frequent periods before they
I think that's what's happening to
really
me.
big.
I know because I think that's what's happening.
Yes, heavy, painful, more frequent periods very often before they get lighter and kind of trail off. I got lucky. And I think, again, everything happens for a reason. My oldest son is almost 14. After I had him, I knew I was done having kids. I got an IUD. It was a progesterone-only IUD because, again, I have the blood clotting disorder. I couldn't take birth control pills. I couldn't take anything with high doses of estrogen in it. So I got a progesterone-only IUD. And at the time, it lasted for 5 years. I got it changed 5 years later, and then they revised it to lasting for 7 years. So I started having all these weird uterine pain symptoms, and I was like, I don't know, I think something's wrong with my IUD. I should just get it changed. And this was 3 years ago. And so she went to take out my IUD, and unfortunately it was stuck in me. So that's a whole other story. It took forever, had to get it surgically removed. And then she went to try and place another one, and she couldn't get it in. And so this is me 3 years ago, going, that was my perimenopausal plan. Like, now I have to have periods, and it's going to be terrible, and I have to wear tampons again. And like, oh my God, because I knew what was going to happen in perimenopause. I didn't realize I was already so far through. This girl only had like 5 more periods total in her life, and then I was done.
Amazing.
So I was like crying about something that actually was pretty insignificant because I didn't realize that I was already on the trailing off end.
That was your estrogen going like this.
That was that.
When I talk about this, because she did it to me in the living room of my house because I was crying and I was like,
I'm like, your estrogen's going like this.
And she's like, yeah, this is happening and this is happening. And here's your progesterone.
Mm-hmm.
And I'm like, and then my brain is going like
and your testosterone's just down here in the basement.
Testosterone's like chilling. He's like, what's up, y'all? We're no sexy time anytime soon. No, okay. What about pellets? We already answered that one.
Yes.
So again, like, these are not just questions on paper. These are not just questions floating around the internet.
These are like questions that I get asked every day by real life people.
Yeah, it's almost like a heartbeat of every woman's day. At some point in time during the day, your perimenopause, menopause, hormone brain is going to come and ask you if this feel like there's something wrong.
There's something wrong with me.
And even if it's just a shadow, you've had a really amazing day. You've been however you paint your amazing day. It's at some point in time, and it's not fair. It's not fair that we have to shove IUDs inside of us. It's not fair that we have to put progesterone creams inside of us so that they don't travel to other places, or if I was wrong with the progesterone.
It's fine.
It's not.
It's not fair.
It's not fair, and then it's not fair that it's just so like, it's such an inconvenience.
Do you know every time I got an IUD, I bought myself something from Tiffany's? It was like a push present. It was my very own push present. I was just like, the very first time I got an IUD, I was like, screw this shit.
I've never had an IUD thing, so.
I'm going to the store right now, right after the IUD. I did. You can ask my husband.
We are going to play a very quick game so that we can end this on a fun. This is literally just my fun stuff. And there's so many things left that I wanted to talk about. But we're going to book your next one before we're even done with this day. Okay. We're going to book. I don't care if it's next Friday. If you got next Friday, we'll be back in here for part 2. But I do want to leave with some fun ones because we do have to have a little bit of like mischief. I mean, we've got Leslie in the class, okay?
That's right.
And I like to make you kind of like exasperated sometimes. That's like one of my favorite things. And you go like,
like my really teenager who rage baits me?
Rage baits you, yes. Some of that might be in here. We're going to do a real quick one. It's called Words We Love and Misuse.
Okay.
Homeostasis, that's right. Correct?
Yes, that's right.
Okay, perfect. And it is the balance in the body. It's how we are alive.
Yes.
Homeostasis.
I like
which is what we always want to find, right? Homeostasis.
It's beautiful.
Talking about how back to the brain and all that neuroplasticity.
Neuroplasticity, that's a good word.
That is the brain's ability to rewire and adapt.
And we always want to stay in a state of neuroplasticity.
Exactly.
Yes.
Hypertrophy. Muscle growth from strength training.
Yes.
I feel like dopamine and endorphins, I'm saying all those right. Motivation, I love all this. And I'm like, why? We didn't even get it. This is not. Okay, this is the fun one. Okay. This or that. Heels at the airport or no?
No.
Heels at the pool or no? Like wedge heels?
No.
Okay. Cardigans or no?
No.
Sports bras or no?
Yes.
Thongs or no?
It depends.
Okay. Jewelry finishes the outfit or no? Or perfume? Jewelry or perfume?
Jewelry.
Love it. Pilates or lifting?
Lifting.
Yoga or spin? And these are your personal, like your choices. Yes. Yoga, she's not judging. Yoga or spin?
Oh,
Break your vagina or
neither.
break your back?
I know, I don't like either.
Solo gym or group class?
Solo.
Yeah. Pre-workout or no pre-workout? God, this goes back to what we got in our cups, which we're going to talk about.
It's so
Everybody's going to be, first of all, it's cheers.
What's in our cup? You'll
What's in
find
our
out
cup?
if you
We're gonna
come
have
back.
to, yeah, we'll be talking about it. Okay, pre-workout or no?
It depends.
Sweatbands or no?
No.
Do you wear a sweatband? Hot yoga or no?
I told you about that, right?
Yeah.
It's a no for me.
It's a no for me,
It's a
too.
no for me.
Green juice or iced coffee?
Ooh, I like both.
Both. Mediterranean or Mexican?
These are hard. Mediterranean.
Food or man? I'm just
Food
kidding.
or man? Oh.
Sweet or salty?
Salty.
Dessert before dinner or dessert for dinner? Or no dessert?
Dessert after dinner. You want to know why?
Why?
Because if you pair a carb with a protein, then your glucose spike doesn't go it goes like this instead of like this.
Oh, so eat some.
So if you eat your
meat,
piece of chicken first, then you have that cake right after. Instead of if you just had the cake, it would go and you'd feel like trash.
Dang it.
Like when I went to my high school mom's brunch this morning and I had all this monkey bread. After I came home, I felt like trash because all I ate was carbs. But if I had a protein option, then I wouldn't have felt like trash.
I love that. That's
Yes.
very interesting
So
woman
smart, right?
knowledge. Sauna or ice bath?
Sauna.
Cuffed pants or burn them all?
Cuffed pants.
Morning person or night owl?
Night owl.
Tattoos or no?
Tattoos.
Piercings or no?
Piercings.
Long nails or no?
Long.
Okay, I just have one last thing to wrap it up, okay? And here we go. These are my what the fuck facts, and these are going to make your eyes roll, Laurie. I'm so excited. Egyptians used crocodile dung as birth control.
This is a fact?
This is a fact.
Oh.
This is a fact. Ancient Romans brushed their teeth with urine for the ammonia. I'm keeping this in some medical stuff for you. Just then that way you've got these facts.
Yeah.
Ancient Greeks prescribed gladiator blood as a cure for epilepsy. How did they even know about epilepsy?
I don't know. I wonder if it worked.
We need to look this up. Medieval Europeans believed wearing a ruby could protect against the plague. Well, we need to go buy some rubies.
I love it. Let's try.
Let's go buy some rubies.
Let's try. Yeah.
Native American medicine, willow bark tea is used for pain relief. It's the natural precursor to aspirin, which I knew about the aspen tree. That's why they eat the
I think I might have known that.
Tobacco was used ceremoniously in prayer and offerings, not recreationally. Echinacea root was used to treat infections and wound. Cornmeal is considered sacred medicine and used in cleaning rituals. You want to know about the Amazonians?
Absolutely.
Awashukwa, brewed for spiritual healing, still used today in trauma and addiction. Ayahuasca. So people still use, I'm going to look that up, ayahuasca brewed. So people still use it today in trauma and addiction therapy. Poison dart frog secretions used for hunting, now studied for pain relief.
Exciting.
Cambo frog secretion vaccine used for detox and stamina.
I feel like there's a lot of secretions.
In the Amazonian tribal practices, it seems like they are very they're going to use all of it.
It's homeopathic.
Guasa tea, a natural stimulant with double the antioxidants of green tea, drunk before sunrise ceremonies. Well, that wasn't really anything interesting. But I am going to look at all that stuff. We were going to talk about Reiki. We're going to talk about chakra. We're going to talk about bioidentical peptides.
Bioactive peptides. I know it gets
peptides.
confusing because we have bioidentical
We were
hormones
talking
and
about-
bioactive
and that
peptides.
might actually be a really good reason to have it separated. But there was so much information, and someone called me whenever we did our video. We did a video at my house where she was explaining all the hormones, and in the last,
Or the peptides.
the peptides, it cut because someone. So I have
Oh,
a lot
no.
of. I have like a good hour of footage without a closing. So
Aw.
we're going to definitely incorporate our next podcast is going to have all the fun stuff that we do to stay optimal,
Yes.
to stay feeling our best. It's the stuff that we do on a day. I feel like you probably better than me, but what I do on a daily basis that you have introduced me to help me balance out all this bullshit
We have
that's
to talk about
happening
that.
inside.
And we didn't even talk about the long-term benefits of hormone replacement therapy. So that goes with that.
So there's going to be a part 2, but there's only so many hours in a busy woman's day with 2 sons, a very busy husband, and her own very busy life where you're constantly, I don't know where you get the time. You run, I just don't know where you get the time. But I definitely appreciate Laurie coming in and speaking with us today at After the Anchor podcast about women's health and just all the stuff that we experience.
I loved it. It was so much fun.
Did you have
fun? And I'm
fun?
honored.
Okay, so for sure, cheers. And I have now closed out with high fives. So high fives to us for doing the hard stuff.
That's
and
right.
I'm excited. We're going to book the next podcast, and we
right.
will see you again with After the Anchor next time.
See ya.
Bye.
Bye.
And that's that.
That's it.
That
Did we
is
do
that.
it? Oh,
We did
it.